Let's take a second to recall our feelings from March 11, 2020, when the World Health Organization labeled COVID-19 a pandemic. I felt anxious, lost, and trapped. Let's take a look at this map. And now remember where you were on this map when you heard the news. I was in Doha while my family was in Karachi. This does not look like a lot of distance, but the global travel restrictions meant I could not be with them. I was stranded, but the world had bigger battles to fight, with no battle being too small to be fought alone. By the end of March, cities in the developed world were reeling from COVID-19, with many declaring public health emergencies. The exponential rise in cases meant that there were severe shortages of personal protective equipment as people scrambled to secure masks, gloves, and sanitizers. It was a classic case of individualistic survival instincts jeopardizing the needs of a community. I could not even wrap my head around how a developing country like Pakistan with a broken healthcare network could cope with a crisis like this. And I was not the only one who felt this way. In early April, I received a conference call from two of my friends from high school who echoed similar concerns. One was at Massachusetts Institute of Technology, while the other was at Lahore University of Management Sciences. Both our families resided in Karachi, the most densely populated city in Pakistan. On your left is Brooklyn, which has a population density of 14,158 people per square kilometer. Compare that to my hometown, Karachi. You can see that it's about 7 times more, it has 7 times more people crammed in the same area. But hang on, why am I going on and on about density? Well, densely populated areas make social distancing virtually impossible. Therefore, density is a crucial marker for any setting when predicting the spread of a transmissible disease such as COVID-19. All three of us share the same fear. How would a city with over 16 million people deal with COVID-19 when developed cities were brought to their knees? We knew the only way to change was regroup for our resolve. While there were a multitude of issues that we could address, we knew focusing our efforts was key to making any tangible impact. At the end of the day, we got together with 3 more of our friends and high school and college mates to form Mask Banao, a public health awareness campaign that translates to make a mask. With Mask Banao, our goal was singular, an idea that was guided by the multidisciplinary knowledge of the group. We wanted to leverage the selfish survival instincts of humans to address the dire needs of the wider humanity. Our idea was simple: use the power of the internet to get people to make masks at home, so that we can secure the supply of medical-grade PPE for frontline workers and healthcare professionals who are at the greatest exposure to COVID-19. Sounds pretty simple, doesn't it? You replace anxiety caused by helplessness with the agency of individuals to take a step towards their own protection. And in effect, you eliminate a supply chain shortage that was proving fatal worldwide. But this came with its own set of challenges. People were already skeptical about the efficacy of masks, let alone the ones that were made at home. Sadly for us, it wasn't just limited to the public. The skepticism transcended to the government itself. Due to some connections, we were able to pitch our idea to the governor of Sindh, which is the second most populous province of Pakistan. Unfortunately, he did not see how masks would prevent a public health catastrophe and declined to implement it on a state level. This meant we had to challenge our idea to public ourselves. While we had scientific research to back our idea, how would we communicate to a country where literacy rate stood at around 62%? To make matters worse, most research available to us was published in English, a language that is not native to Pakistan. Localizing public health messaging was therefore our greatest challenge. To circumvent this, we casted a wider net by partnering with more students that wrote, spoke, and understood not only Urdu, the national language, but local languages such as Hindi. We were also fortunate to work with established local and budding international artists such as Shazil Malik in Pakistan and Natasha Hurt in the United States, so that we could create popular artworks that spoke to the multi-ethnic population of the country. Overall, Mask Banao took a tri-pronged approach. First, we created a knowledge base about making masks at home. This was available on demand by logging on to our website. But of course, how would people know they can create masks using household supplies? So to reach those, we created a content studio run by students around the world to bite-size complicated information through infographics, excerpts, and videos using a multi-platform campaign on social media. But both these approaches only tapped into the digitally literate audiences in a country where internet penetration is still a measly 17.1%. While we were gaining steam on social media, we started pitching and running features on national newspapers, eventually speaking at primetime news hours on some of the most watched television channels of the country. We also leveraged the influence of local celebrities to amplify our message to their audience. Let's watch a quick montage of our reach.
हमें होममेड मास्क बनाने चाहिए।
2 मिनट में मास्क बना सकते हैं, 5 मिनट में बना सकते हैं।
आपकी टी शर्ट हो गई, आपकी हुडी हो गई, आप उससे मास्क बनाएं।
Like this.
Oh, it's pretty good.
मास्क बनाओ।
During the 4 months of its running, Mask Banao reached over 50 million across all forms of media, eventually phasing into a million mask project, which leveraged textile factories that were out of service due to cancelled orders to produce masks for communities where they were still inaccessible. The campaign essentially reduced skepticism around masks while making them accessible to all by responding to the PPE shortage and protecting frontline workers. Remember that map I showed you in the beginning? Let's bring it back. We started with a few nodes, some students stranded in their dorm rooms, virtually powerless and sincerely anxious about the state of the country in a pandemic. We ended with almost 50 volunteers, mostly students, around the world who came together to face adversity with humanity. At the end of the day, while there is no battle too small to be fought alone, there are also none too large to be won together. Thank you.